Are you worried about losing too much hair? Are you confused about the recommendations and miracle products you see advertised online? Maybe you're just curious what is normal hair loss and when it becomes abnormal. Welcome to the Brave and Curious podcast. I'm your host, Dr. Lora Shahine, double board certified OBGYN and reproductive endocrinologist, and I love learning all about different topics. Today, I am curious about hair loss in women. And here to teach us all about it is my friend and board certified dermatologist, Dr. Joyce Park, founder of the virtual dermatology clinic Skin Refinery and content creator and educator at Tea with MD on all social media platforms. Let's get started. Welcome, Joyce. I'm so happy to have you here.
Thanks for having me.
We're talking about a really sensitive topic for a lot of women. I've seen you post a lot about hair loss, and that got me thinking that I wanted to ask more. I mean, of course, some guys don't want to lose hair, but I've seen those studies where it actually shows you're more masculine, and a lot of guys embrace it and they go bald, like Jason Statham or Bruce Willis back in the day. But for women, it really can be a part of who they are, their femininity, and to lose hair, it's just it can be a really, really sensitive topic. So thank you for talking to us about this today.
Oh yeah, thank you for having me on as a guest. This is truly such a sensitive topic, and I think it's so timely because so many people are losing hair. It started with, I think, after COVID, and we'll talk through all the different causes of hair loss, but after COVID, I saw so much hair loss in my clinic from illness, from stress. And then I experienced hair loss myself twice in the postpartum period.
Yeah.
And even now, just talking to friends and family, I see a lot of it. And so I think this is such an important topic. So thanks for having me on.
Yeah. Well, it's hard too because naturally we lose hair. It's normal to brush your hair and to see hair in the hairbrush or in the shower. It's a natural process. But how do patients know when it's not normal, not normal shedding? How do they kind of know when to ask for help?
Right. So it is normal to lose about 50 to 100 hairs a day. So I have patients who come in and bring a bag of hair, or they'll show me a Ziploc bag of hair on our telederm appointment, and they'll say, look at how many hairs this is. 50 to 100 can actually feel like quite a bit.
Okay.
But how I tell my patients, when does it tip the scale into something that you might need to get evaluated is when you're losing more than 100 hairs a day. And there's multiple different ways to think about it, but you can have loss of new hairs, so you're not seeing new hairs grow out, or you're seeing a lot of shedding of your hairs. So for example, in telogen effluvium, you're seeing shedding everywhere, massive shedding, and it's all over. It's in your food when you eat. It's all over your pillow when you wake up. Your shower floor is covered in hairs, and it's just It's everywhere.
What is that word that you just said? I honestly hadn't heard of that.
Telogen effluvium.
Is that just it's just massively coming out?
Yes. Well, actually, so I wanted to take a step back and talk about the hair cycle because I think that can help set the stage for how we talk about the various types of hair loss.
Great.
So our hair mainly falls into 3 stages, and this is your hair cycle. So you have anagen, which is the growth phase, and that's what about 90% of your hairs at any given time are in. And that's your actively growing phase, when the follicles are active and the hairs are growing and the stem cells are actively making new hair. Then you have catagen, which is kind of the transition between anagen to telogen. Catagen is maybe 1% of your hairs at any time, and it really is just a transition from the growing phase to the shedding phase. And then you have your telogen phase, which is what I referenced in the telogen effluvium. And this is your shedding phase. So this is approximately 10% of your hairs. And this cycle takes about 2 to 3 months to cycle through. And that truly is when the hair is shed and released from your head.
Okay.
And so different diseases, different conditions impact different parts of the hair cycle. So for example, telogen effluvium is a condition that occurs when your hair gets shocked into the telogen phase. This happens after a significant stressor, the most common one being childbirth. You can also see this after a big emotional stress like new job, move across the country, big life event like a divorce or death of a loved one. You can also see this after surgery,
Mm.
major illness like COVID, or even after major weight loss. So we are seeing more people who are on Ozempic and other weight loss medications have more telogen effluvium as well. And so this occurs when about 2 to 3 months after the initial stressor, when all your hair is shifted into the telogen phase, then you see this massive shedding. So
Mm.
that affects your telogen phase. Whereas there's a condition like anagen effluvium, which affects the growing phase. And we see that commonly in patients undergoing chemotherapy, because chemotherapy targets actively dividing cells. And
Hmm.
so the chemo targets the hairs in the anagen phase, and they see like a loss of those anagen hairs.
Okay.
There's all sorts of reasons why
Yes.
people lose hair, and it's very multifactorial, ranging from genetics to hormones to environmental exposures. And that's why it's so important to get it checked by a
Yeah.
dermatologist, because the treatment really depends on the underlying cause.
Okay. So then for someone that just feels like it's more than what they've ever seen before, and, even if they can rationalize it, like it's 2 or 3 months postpartum and like, oh, that kind of makes sense. Like, how can they get their doctor to pay attention? Like, how do they describe how much it is as opposed to just saying, oh, I think I'm having hair loss. And then they're just like, oh, I'm sure it's fine. How can they come across to sort of say, no, I'm really worried about this. I really want to get some evaluation for this. Like, how do they describe it to the doctor to sort of get some, you know, attention?
Definitely. So, if you're talking to a dermatologist, we would take you seriously, because we
Yeah.
know that hair loss is a real concern and it's very prevalent. And so, there's a whole set of questions that we would go through. But for someone who's talking maybe to a primary care doctor who's very busy, has a full clinic of patients, some of the things you would want to tell this person is maybe try to quantify how many hairs you might be losing if it's really over 100, because you can shed 100 hairs daily as like normally. You can also tell them if you have any scalp issues,
Mm.
because that would raise a red flag for something underlying, like a deeper condition going on. So if you're experiencing flaking, redness, soreness,
Mm.
itching,
Mm-hmm.
those are all things that your doctor would want to know about. You can also talk to them about, you can also show them photos. Actually, that's very helpful. So,
That's a good
tracking
idea.
your hair loss over time, showing how your hair has changed, that can be very useful, not only for your doctor to see, but also for yourself,
Mm-hmm.
because the change happens so gradually that it can be hard to notice. So, this could be a good way for you to keep track of it too.
Okay, that's really great. And then when someone does come to you, because I mean, I think some people might not even realize that dermatologists focus on hair loss. So I think
Right.
it's nice to even just know that if someone is having this issue, like seeking a dermatologist that has an interest in hair loss is really important. When they come to you, what kind of questions are you asking, or what are you thinking about in your differential when you're sort of trying to figure out what's causing the hair loss?
Yeah, so definitely a great point to bring up is that dermatologists can treat hair loss in the first place. You're right, a lot of people are shocked to hear that we actually study hair extensively in residency. We learn about all the different conditions that can affect the scalp and also the hair, and we learn how to read even skin biopsies, scalp biopsies under the microscope to look for the underlying cause of the hair loss. And so, yes, as dermatologists, we treat not only skin, but also hair and nails too. I think that's
Great.
something that a lot of people don't know. So, when a patient comes in and they're telling me that they're experiencing hair loss, there's a list of questions that I will step through. And the main reason for doing this is to understand, first of all, is this scarring hair loss or non scarring hair loss? And the reason why that's very essential is scarring hair loss is an inflammatory process that can destroy the hair follicle and cause permanent hair loss. Whereas non-scarring hair loss is, there's chance for the hairs to be recovered because the follicle is not gone.
Okay.
So that's a very important distinction between the two categories of hair loss. That's very critical to make early on because the treatments for the two are entirely different.
Okay.
So I will always ask patients about environmental exposures, what's going on in their life. Have they been under a big life stressor? Asking for those triggers of telogen effluvium. Have you lost weight? Have you had surgery, major illness, big change in your life, major stressor? I'll ask about their diet. Are you vegetarian? Are you getting enough protein in your diet? And I'll ask about scalp symptoms, any redness, itching, burning, flaking. And then I'll ask about the location of their hair loss. Is it diffuse hair loss all over? Is it just a small patch, a small bald patch, which signals more like alopecia areata? Is it, are you noticing shedding or just kind of gradual thinning without much shedding? Is it in the crown? Is it widening of your part, which leads me to think more androgenetic alopecia? What about how do you style your hair? Are you constantly wearing it in tight buns or really tight braids, which can lead to traction alopecia over time?
And
Tell
just
me about your
for
family
us
history.
listening,
Yes,
alopecia just means hair loss, right?
that's
So
right.
you're
That's
kind of
right.
going through this differential. Like I heard you say the word androgen alopecia. That's like related. Androgens are male hormones. So is it like related
Correct.
to an imbalance of hormones? And then
That's
so yeah,
right.
just appreciate, because yeah, I mean, I haven't thought about this since I was in medical school, which is like 25 years ago. So just, I love, and you're doing this every single day. So it's super, super helpful. And then I wanted to step back when you say scarring versus non-scarring. Could you give a couple of examples of what like scarring and what non-scarring would be?
Yeah. So, for example, non-scarring alopecia would be like telogen effluvium, something that's
Okay.
self-limited. There's a
Mm-hmm.
trigger, and we have a really good chance of growing the hair back.
Okay.
Even female or male pattern hair loss would
Okay.
start off as a non-scarring alopecia, but over time, as it progresses, it could transform into a scarring alopecia. And then on the other hand, there's scarring alopecias, which maybe are not as well known, but that would be things like frontal fibrosing alopecia, lichen planopilaris, central centrifugal cicatricial alopecia, or CCCA. And those
Wow.
scarring alopecias we think of more as having a lot of scalp symptoms.
Okay.
So we usually see those accompanied by soreness, itching, intense redness, scaling around the follicles, and sometimes even pain. There are times when I look at the scalp, I do the physical exam, I look at the scalp with the dermatoscope, and we are trained to see certain signs or red flags for what would be scarring versus non-scarring alopecias.
Okay.
But one thing we can also do to clinch the diagnosis is to take a scalp biopsy.
Okay.
And that's really important. We numb up the skin, we do a little punch biopsy, like a 4 millimeter punch, and then we send that off to the lab so that the dermatopathologist can look at the scalp under the microscope and see all the layers of the skin and give us a definitive diagnosis of what is going on under the skin.
Yeah. So, like, as a patient who's listening, I would be hearing, like, gosh, if I'm having a lot of these symptoms, I probably might need to get a referral from my primary care doctor, but I'm going to be really wanting to see a dermatologist, not just like going to maybe the drugstore or trying to take a supplement to kind of fix this on my own, but like really trying to get a diagnosis. That's just like a red flag that kind of went up when I was listening to you.
Absolutely, absolutely. So if you are experiencing scalp symptoms like we talked about, that burning, itching, scaling, redness, that would be a sign to go seek help from a physician, because it could be a sign that you're having scarring alopecia, and there early intervention and treatment is key.
Okay.
Now, of course, you might also have something benign like dandruff, which can also be itchy, but it's still good to get it checked out.
So, what kind of nutrition or diet things could cause hair loss?
Yeah, so I always make sure that patients are having adequate protein intake, because that's one of the things protein is one of the things that you need, that's the building blocks of hair. I also want to make sure that patients are not biotin deficient. We see a ton of gummies and supplements with extremely high percentages of biotin, which I don't recommend, but you want to make sure at least you're not biotin deficient. I also want to make sure patients are not iron deficient. So this kind of gets into blood work that I might potentially check. So I would usually check iron levels or ferritin levels to make sure they're not iron deficient. I also check TSH because sometimes thyroid disease can also lead to alopecia. And I usually also check a vitamin D, which, as you know, in Seattle, most of us are deficient.
Absolutely. I know 85% of people in the state of Washington are vitamin D deficient. So I am talking to my fertility
Wow.
patients about it all the time too.
Oh,
Yeah. Yeah. Yeah.
wow.
Yeah. I know. So yeah, I totally agree. So that is really helpful to think about questions that you ask, blood tests that you might do. What about certain conditions that are associated with hair loss, like PCOS, for example?
PCOS is really interesting as it relates to hair because it can cause hirsutism or unwanted hair growth around like the mustache area, sides of the face, but it can also cause decreased hair similar to androgenetic alopecia. And this is all from the elevated androgens. And so I'm commonly talking to patients about ways to remove unwanted hair on their face while trying to grow more hair on their head. So it's a very interesting kind of constellation of symptoms that you can see there with the hair due to androgens.
Yeah.
So for PCOS patients with hair loss, I like to recommend spironolactone.
Yeah. What is that?
That's Yeah, so spironolactone is an oral medication that was originally used as a blood pressure medication, but we found that it can have really beneficial effects for conditions in dermatology that are related to excess androgens, like hormonal acne or androgenetic alopecia. So I commonly prescribe spironolactone to patients for acne, but also if you're experiencing female pattern hair loss.
Yeah, it's funny. When you look up online, like common symptoms of PCOS, hirsutism or extra, thicker hairs kind of in central, like mustache, chin, often comes up, but people don't really talk about the hair loss that is associated. And I'm glad that you brought that up because, like you said, I do talk to my patients about it in like a male patterned baldness, like receding hairline and here at the crown. And like you said, it's a hormonal relationship. So I do sometimes see that, but it's not really very widely known. I appreciate you bringing that up.
Oh,
How
yeah.
about why do we lose hair postpartum? Like what you mentioned that before. What's happening?
Yeah, so postpartum, a lot of it has to do with telogen effluvium. So the act of giving birth and going through childbirth is such a huge stress on our bodies. It really does cause a shock to our bodies and actually a shock to our hair as well. And so that's why when you deliver a baby, the hair gets shifted from the anagen phase into the telogen phase. And the telogen phase takes about 2 to 3 months to complete. And so, usually, about 3 months after childbirth, you'll start to see this massive shedding of hair. And it can be very, very scary. I
Hmm.
mean, I experienced it twice, and it definitely is. It's hard as you're going through all the other difficulties in the postpartum period to also see so much hair coming out every time you shower or brush your hair. It's very emotional. It can be very
Yeah.
difficult.
Yeah,
And
absolutely.
so, to those patients, I try to provide a lot of reassurance that telogen effluvium is self limited. It can last up to a year. You
Mm.
don't necessarily have to do anything to intervene because your hair will cycle back to normal.
Okay.
But if you really did want to do something, you could try topical minoxidil.
Okay. And what does that do?
So, minoxidil is really one of the best treatments we have that's over the counter for hair loss, both for men and women. And we think it works by improving circulation in the scalp.
Okay.
And it comes as a 2% or 5% foam or liquid. And I always tell everyone to use the 5%. There's no reason to go for the 2%, even though they market it to women, but 5% is totally safe and recommended for
Yeah,
women to
thank you. I
use.
saw your TikTok and or Instagram reel on that, and I just never even thought about that. Like, why do they even? Anyway, we won't always understand marketers or, but yeah, I think that it was really reassuring to have you, a dermatologist and expert, say no, it's okay to take the 5%, which I assume would work better. Is that right?
That's right. Right.
Yeah.
It's a more concentrated form of minoxidil. And as dermatologists, we can also compound minoxidil for you and prescribe it for you at higher percentages. But I usually have patients start with the 5%, and you can use foam or solution. The foam is a little bit less irritating, but sometimes it can get stuck in your hair.
Mm,
The liquid, it's a little easier to get right on the scalp, but it can cause a rash. And
mm.
so I recommend using a makeup brush actually to apply the Rogaine in a more concentrated, directed fashion so that you don't get drippage all over your face. Because one of the side effects is that you'll get unwanted hair growth wherever it's applied.
That makes sense, but thanks
Right.
for the reminder. So you just said Rogaine, but minoxidil and Rogaine, are they the same thing?
Yes.
Okay.
Yes. Rogaine and minoxidil are the same thing. Rogaine is the brand name for it, but there's lots of
Okay.
generic versions of minoxidil, and more brands are coming out with their version of minoxidil as well.
Okay, that's great. We're going to get back to learning more about hair loss in women from Dr. Joyce Park in just a minute, but I wanted to pause and thank you for being here. The show is here because of you, and I appreciate you so much. Please take a minute to support the show. Follow the show wherever you are listening. And if you have another minute to help us out, a 5-star review with a comment about what you find valuable means so much. It helps others find the show as well. Thank you again for being here. Now let's get back to learning. So, what I heard is, how to take it seriously, who to see. Like this is, you go to your dermatologist. Your dermatologist is really going to figure out if this is a scarring type, like scalp associated, you mentioned things that I couldn't even possibly repeat, but it's like a dermatologist needs to figure out if it's those things and treat those appropriately. If it's non-scarring, it could be hormone related. It could be diet related. You want to think about iron, vitamin D, your thyroid. You want to think about like stressful events that could have shocked. And it's like, oh, okay, that does make sense. This is postpartum, or it was a couple of months after losing a loved one or something. And so now you're in this sort of, you've ruled out the, scarring thing. You've figured it out a little bit. You're watching your diet. So now if that person's like trying to rebuild their hair, they're reassured by you, like, hey, this is postpartum, this is, I've made sure it's not all these other things. We started talking a little bit about treatment, but like, what are some other things people can do? They made sure it's not the bad stuff. They're being treated. They really want to up their, the replacement of the hair or like get it back.
Yeah.
What are some non-supplement, sort of non-pharmaceutical things that people could do to help their hair growth? Are there any lifestyle optimization things, nutrition, or things that people can do to help hair growth?
Yeah, so nutrition wise, I think just having a well balanced diet and making sure that you're ingesting enough protein is can be very helpful. And then there's a whole host of things that you can do to give your scalp the best chance to grow healthy hair, because so more and more we're realizing that just like you take care of the skin on your face, you need to take care of the skin on your scalp too.
Okay.
And having a healthy scalp really is key to having healthy hair.
Okay.
So one thing I like to tell patients who are struggling with hair loss is to incorporate an anti-inflammatory shampoo into their rotation. So that would be in the form of an anti-dandruff shampoo, whether that's an active ingredient like selenium sulfide or ketoconazole or parathione zinc. We typically think of these as anti-dandruff shampoos, but anything we can do to decrease inflammation on the scalp can be helpful in establishing that healthy scalp environment. So I usually will have hair loss patients use one of those anti-dandruff shampoos at least once a week.
That's great. I've never heard of that before. Thank you. Okay,
Yeah.
so healthy diet, anti-dandruff shampoo. What about things that people can do, as far as like you talked about braiding their hair or wearing like, rubber bands all the time? Like, do you
Right.
counsel your patients about that too?
Yeah, I definitely tell patients to wear their hair in more relaxed styles and not super, super tight braids or hairstyles where their hair is just being pulled back with a lot of force.
Hmm.
It's okay if you do that once in a while. If you really love that style, I don't want to say you can't ever do it, but give it a break and
Okay.
rotate through different hairstyles. Because if you wear your hair like that all the time, you
Hmm.
actually risk causing traction alopecia, which is where you start to get hair loss in those areas where your hair is pulled back so far that it actually damages the hair follicles.
Okay, I'm absolutely picturing Ariana Grande right now because she
You're
always has
so
this
right.
beautiful, ponytail, but she just does it like every single event, and I'm like, oh my gosh. Okay,
Who's going to tell her?
I know. Let's let her know gently. How about hair dryers? Hair treatments. Straightening or coloring.
Yeah, coloring your hair is safe. That's fine to do. With hair dryers, it's there actually was a study done on this in South Korea, but they found that the best way to dry your hair is actually on low heat, as we can imagine, because high heat can damage your hair, and to constantly keep it moving, so not keeping it on
Mm-hmm.
one section of the hair continuously for too long, and at a distance of about 15 centimeters away from the scalp or from away from the hair. So kind
Yeah.
of keep it moving, set distance away, and not the highest temperature.
Okay, that's
And
great.
if you're going to heat style your hair, always make sure to use a heat protectant.
Okay, thank you. Is that sort of like a pre-hair dryer? Like, what would someone look for as a heat protectant product?
That's right. It's usually after you, so let's just go through your hair care routine for
Great.
hair loss, right? I was thinking about this because I'm going to make a video on this soon. So you use your shampoo and your conditioner in the shower, you come out, you towel dry your hair, and then this is where you would put on your treatment. So this is where you would use your minoxidil foam or your solution. And if you have an allergy to minoxidil or you prefer not to use it, or actually some people prefer not to use minoxidil because they have pets, and topical minoxidil can be toxic to cats and
Hmm.
dogs. And so if you don't want to use minoxidil, you can also use other types of scalp serums that have science-backed, clinically validated technologies within them.
Okay.
There's a whole host of ingredients that could be helpful topically. And so
Okay.
this is where you would use your serum. And actually, I didn't talk about this yet, but there's some things you can pair with your minoxidil that can make it even more effective. So, tretinoin cream, like a retinoid, can actually be helpful. You apply it before you apply the minoxidil, and that can
Hmm.
actually help enhance the penetration of the minoxidil as well.
That's cool. And I never thought about recommending minoxidil after the shower. For some reason, I would just think like, oh, like wet hair or something. I don't know why. So it is better to do it like you're out of the shower. You put the serum kind of on uh, after the retinoin. This is
Yeah,
fascinating.
so you can use minoxidil on wet or dry hair.
Oh, okay. Got it.
Yes, yes.
Okay.
It just depends on your lifestyle, but
Mm.
I usually recommend using it twice a day. But some
Oh.
of my patients, they don't like how it makes their scalp feel greasy. They don't like how
Hmm.
it affects how their hair looks. And
Okay.
so they prefer to just use it at night once
Got
a
it.
day. And
Okay.
then if they feel that way, then I would recommend them to use something else, a non-minoxidil alternative in the daytime, something that doesn't affect their appearance or leave their scalp or their hair looking oily.
Okay. That's great. All right. We're out of the shower. We towel dried. We put our
Yes.
treatment on.
Yep, yep. And then before you dry your hair, that's when you would use a heat protectant. They usually come in the form of sprays,
Mhm.
and you would do a really thorough spray all over, and then you can do your blow drying.
Okay,
Yes.
perfect. That's
And then your
great.
styling products go on after that.
Okay, I love it. Thank you. And then what about supplements for hair loss? There's so much information on social media and so on TikTok shop. Oh my gosh.
Oh, I know
Like,
exactly what you're talking about.
yes. So, I love that people are trying to educate, advocate, like that's all good things, but it's just really hard because a lot of supplements aren't, verified. They aren't, double, triple checked. But are there supplements that have been shown to help with hair loss? We talked about vitamin D and we talked about iron,
Right,
but what about
right.
others?
So, supplements for hair loss is a whole this could be a whole conversation on its
Understood.
own. Supplements are such a gray area because they are not regulated.
Yeah.
And they're not tested for safety or for, the percent daily values. Sometimes you see crazy high amounts of certain vitamins in supplements, and you're just scratching your head and you're like, how is this allowed?
Yeah.
So it can be very challenging to figure out which ones are actually effective.
Okay.
The ones that I look to, the ones that I recommend to patients are ones that have been clinically validated in third-party testing. So Nutrafol is one that I recommend to patients.
Okay.
I have reviewed the ingredients, they're safe, and they also have done that third-party clinical testing, which a lot of brands don't do because it's very, very expensive to do that. So Nutrafol has done that. Viviscal is another brand that I do recommend. And then there are 2 dermatologist formulated brands that have similar ingredients to those, and that's Inner Glow Vitamins and Untangled.
Okay.
I have no conflict of interest with any of these 4 brands, but those are usually the ones that I recommend to patients. And I do want to highlight here that some of them have really high levels of biotin, which to me is a red flag because you don't really need that much biotin because it's rare for people to be biotin deficient. It's rare for biotin deficiency to be the actual primary cause of your hair loss. And it can actually be detrimental to intake that much biotin because it can interfere with really important blood tests. It can interfere with your thyroid tests or your troponin lab tests, which is a marker of heart attack. Yeah. So I don't like supplements that contain really, really high percentage daily values of biotin. Yeah. That's one thing. And then the second thing I'll say is that, and I am also going to make a video on this soon, is that there has been a case report of liver injury tied to Nutrafol. And it hasn't been completely clear what exactly is causing it, but some people think it might be the ashwagandha within it. And so if you have liver disease to begin with, or if you have any other underlying condition, honestly, you have to please check with your doctor before taking supplements because a lot of people also take multiple supplements and all those vitamins just stack up. And that really worries me.
I know. It's a feeling of feeling out of control, whether it's fertility or losing your hair. And it feels like you're taking action to take back control. And you see a recommendation online and it just kind of feels good. It's just that, without third-party testing, you never really know exactly what it is. And like you said, it can really add up and sort of interfere, and they can interfere with each other. So, and what's really hard is a lot of times people will say, oh, well, will you review all my supplements? And honestly, without you and I can't be like, oh, I'm sure this is absolutely fine. There just aren't studies in it. So in general, kind of less is more. But I appreciate your kind of finding some supplements that might be helpful that are third-party tested, but also that really important reminder that, Joyce and I are not your doctors, and you just got to be really careful about what you're taking. But I did want to address it because a lot of people will ask me, well, is there a supplement I can take? What else can people do at home? What about like red light therapy for hair loss?
Yeah, there is some evidence that can be beneficial.
Okay.
I think with red light therapy, just like it is with skincare with the LED masks, it's all about consistency. So how consistent can you be with it? And that's actually the key to success with hair loss treatments in general, is just consistency and using the medications and the treatment protocols and doing it every single day, because it takes a long time to grow hair. With any type, even with minoxidil, right? You will not really see any new hair growth for about at least 3 months, but it's more so 6 months. Usually when I see patients for hair loss, I don't see them in follow-up until at least 6 months afterwards, because I know there will be nothing to see before that. And so that's a really important point for patients to understand, is that you have to be patient and to stick with the treatments, and it really will take a long time. So setting that expectation at least 3 months before expecting to see anything.
Yeah, that's really, really helpful. And what could they look for after 3 to 6 months? I mean, will they start to see those little like baby hairs that like kind of stick up, or how do they know? Yeah,
exactly. I was actually just looking in my bathroom mirror earlier today because I was doing some filming for hair care content, and I was looking to see all my little baby hairs, and I noticed also that I have bangs, which I never cut these bangs. They're just from my new hair growth after I
Yes.
had my daughter last year.
Oh,
So funny. So, yes, you can start to see those little baby hairs. They'll be like sticking up.
yeah.
The fringe. You can always see who has had a baby in the last year because you'll see the fringe of new hairs around the face. So that's a really good indication that it's working. And another indication is if you're using minoxidil and you experience what's called the dread shed, that's when you see an initial shedding of a lot of hairs. And this can
Mm.
be very scary to patients. But that's actually a good sign because that means all those hairs were already in the telogen phase and they need to come out in order for new hairs to grow out.
Oh, and so does minoxidil make that happen a little bit faster?
It kind of, yeah, it kind of unmasks and
Okay.
makes those telogen hairs just shed so that
Okay.
it can make way for the new hairs because
Okay.
minoxidil is promoting the new hair growth. So you have to have those old hairs that were going to come out anyways be
Hmm.
forcing the old hairs out.
Okay. That's really
Yeah.
helpful. I have a question. If someone knows that they are going to have a shock to their system, so someone is getting ready to deliver a baby and they now know after listening to this episode that they're going to lose hair in 2 or 3 months, is there anything that they can do to prevent it?
Oh, that's such a good question. I have never had anyone ask me that question before, but it's a very good question. I don't think so.
Yeah.
I think
I
it's
love
just a natural cycle that your body goes through.
Yeah. Well, and I also love just the fact that you've shared a lot of lifestyle optimization. So it could be continuing to take your prenatal vitamin, which probably has iron in it, and vitamin
Absolutely.
D, I think will
Yes.
probably be helpful. Being aware that it's coming so it's not like a huge shock. You could also ask your OBGYN or midwife to check your thyroid, check your iron, check your vitamin D kind of at that postpartum visit. You could do something
Yeah.
like that.
Yeah.
Um,
Making sure that there's nothing underlying going on, making sure your scalp is as healthy as it can be.
yeah.
And then there are definitely topicals that you could safely use.
Hmm.
Like you can use a lot of the over-the-counter scalp serums. You
Hmm.
can use the massagers. You can use derma rolling. But again, with postpartum hair loss, you don't have to do anything. But
Yeah.
if you want to, you can.
Okay. I think that's great. Thank you. Oh, can I ask just one more question about another treatment I've heard of is PRP for hair loss?
Yes.
Okay.
Yes.
What is that and
PRP,
how does it work?
yeah. So PRP is when you extract blood. So you extract your peripheral blood, you extract your blood via an IV, and then we spin it down in a centrifuge and we collect what's called the liquid gold at the top. This is very rich in platelets and growth factors. And then that's injected back into, well, sometimes the skin, but you can
Hmm.
also inject it back into your scalp for hair loss. And this can be paired with or without microneedling beforehand. And
Okay.
so there are studies that show evidence for hair growth with PRP, with
Okay.
and without microneedling. I would recommend it with microneedling. But
Okay.
the idea is that you have to do this, you can't just do it once. There's very few things with hair loss that you could do once and see results other than a hair transplant. But you would usually purchase a series of PRP sessions spaced 6 to 8 weeks apart. And
Okay.
then you could do this several times, like 3 to 4 times, and before you would expect to see results.
Wow, Joyce, I have learned so much about hair loss. You are such a wealth of information. For someone that is just sitting at home and listening, can you just summarize a little bit about what they could take away from all that they've learned today and how they can take next steps to get their questions answered?
Yeah, definitely. I mean, this is such a complex topic, more complex than people think, probably because hair loss is so multifactorial. So I think one of the important takeaways is to figure out if your hair loss is scarring versus non-scarring, because that scarring type of hair loss really needs a different type of medical treatment and it needs to be intervened upon urgently. And so a physician or a dermatologist can help you make that distinction. But one of the important red flags we talked about is that with scarring alopecias, we usually see a lot of scalp symptoms with the hair loss. We're talking about soreness, pain in the scalp, intense itching, burning, scaling. So if you're experiencing any of that, that really is a very clear sign that you need to seek treatment with a dermatologist right away.
Okay.
So that aside, some things that I would love for your listeners to take away are that there's a lot of things they can do at home. Everyone can start, well, everyone who wants to, can start with 5% minoxidil foam or solution. This is over the counter. You don't need a prescription, and you can easily use this at home once or twice a day. And if you prefer not to use topical minoxidil, if you have pets or if you get allergic reactions to it, there's always other scalp serums that you can use. We also talked about having a really healthy scalp, so incorporating an anti-dandruff shampoo and also having good scalp skin practices. So just the way you take care of your skin, you want to devote that time and attention to your scalp skin as well. And then we talked about supplements, to really be mindful of what you're ingesting, making sure that you're not doubling up on nutrients with your other supplements, and always asking a professional if you need help. And then, of course, seeking help. If you are still experiencing a lot of hair loss despite these at-home treatments, it really is best to see a dermatologist. And we only briefly touched upon this, but there's a whole world of medications that we can prescribe to help you with your hair loss as well, ranging from, we talked about oral spironolactone. There's also oral minoxidil, which is an incredibly powerful treatment for hair loss. Very, very powerful. There's also finasteride. So there's all these other medications we have at our disposal to help patients with severe hair loss. So there's a lot you can do at home, but if it's not working, as with anything, please seek professional help.
Thank you so much, Joyce. I really appreciate your time. How can people find you and learn more from you?
Yeah, definitely. No, this has been so fun and a topic I'm super passionate about, and that's not often talked about enough. So I am making content about hair and skin, but mostly hair now, every single day at Tea with MD, TEA with MD. So that's my handle on Instagram, TikTok, YouTube. I'm making long form deep dives about hair loss and hair care in general on YouTube. And if you speak Chinese, I'm also on Red Note, Xiaohongshu as Tea with MD as well.
Fantastic. Thank you so much, Joyce. I really appreciate your time and all the learning.
Yes, of course. Thank you so much for having me.
I hope you enjoyed this episode. I hope you learned a lot about hair loss. Be sure and share this episode with someone that you know that might be curious about hair loss in women. And if you can take just a minute, follow the show wherever you're listening. Give us a 5-star review and let us know what you found valuable. It means so much. Thank you again for being here. Thank you also to my team at Audiotocracy for producing another wonderful show. This is your host, Dr. Lora Shahine. And until next week, stay brave and curious.